Welcome to Veterinary Vertex, the AVMA Journal's podcast, where we delve into behind-the-scenes look with manuscript authors. I'm Editor-in-Chief Lisa Fortier, joined by Associate Editor Sarah Wright. Today, we're discussing how benign additional liver masses frequently occur with dogs with primary liver masses, with authors Samuel Burkhardt and Hunter Piegols. Hey, Sam and Hunter, thanks so much for taking time out of your busy schedules to be with us here today.
Thank you for joining us, Samuel and Hunter.
Thanks for having us.
Yeah, thank you.
Before we dive in, Samuel, could you share a little bit about your background and what brought you to investigating liver tumors in dogs?
Absolutely. So initially in residency, I actually had a project on liver tumors evaluating basically the efficacy of kind of standard coagulation panels, evaluating PT and APTT. And it seems natural when I was doing a surgical oncology fellowship at The Ohio State University for a next kind of project for fellowship requirements to also further kind of evaluate the liver and continue on sort of a project that takes a kind of a different perspective, I guess, about another, I think, common maybe misconception about the liver and diagnostics and our evaluation of such things. So that's kind of where we came up with this project idea along with Hunter and wanted to, again, evaluate something further.
Samuel, how did you design the study to differentiate benign additional liver masses from malignant ones?
Yeah, so really, of course, to be able to even make such a kind of, I guess, standardization between the two, it really did require that any cases where, we had a primary liver tumor and subsequently found, through imaging, generally CT for our study, that there was going to be an additional mass, which we kind of accepted a mass kind of of any size to not, exclude too many cases. It really required that we had also followed up with a surgical explorer to actually have a diagnosis, histopathologic diagnosis, to be able to kind of delineate between benign and malignant, because there wasn't imaging characteristics that we could, rely on to make such a delineation between the two. So that was a lot of our kind of inclusion criteria was dogs with a primary liver tumor where we had done a liver lobectomy and then also, followed up with a biopsy of the mass that had also been identified on imaging, or at least had a mass that was also identified, I guess, at the time of surgery.
Yeah, tough area to navigate. Hunter, how might these findings influence diagnostic decision-making, like that classic decision tree, 1 if, 2 then B, such as imaging interpretation, or as Sam was just talking about, surgical planning?
Yeah, I think from a clinician standpoint, taking a look at your imaging, you see multiple masses. That should be on your problem list, but where do you put your differentials with that? So should that be viewed as potential metastatic disease or multiple malignant processes? I think our data would suggest that potentially one malignant versus benign or both being benign is still a very real possibility. So being able to have that conversation with owners, I think, is really important. And then from a surgical standpoint, I would still recommend getting at least biopsies of multiple masses when you're in there so you can make the most informed decision making.
That makes sense.
So, Hunter, what are the key take-home messages you hope veterinarians will remember?
I would say probably one of the biggest takeaways is when you have dogs with multiple liver masses, additional benign masses is quite common. And we shouldn't overinterpret the presence of multiple masses as being an indication of metastatic disease. And again, this is really important when discussing with owners because we could paint a falsely negative picture potentially.
Looking forward, Samuel, are there, I know there's a lot of liquid biopsies and other things, but are there specific diagnostic tools or biomarkers that future studies might better distinguish from benign and malignant masses?
Yeah, I think that's a great point to bring up because, obviously we're talking a lot about having to go to surgery to get, perhaps a lot of these answers, but hopefully changing people's perspectives about their kind of preoperative evaluation. So the more tools that we could have before, going into surgery and spending a client's money and, putting them under anesthesia, I think the better that we can set them up. So, Other preoperative things, I feel like in humans, they're able to, use imaging a lot more perhaps than we are, and have been able to use things such as like contrast ultrasound to be able to delineate a little bit more between malignant and benign. I feel like they're also maybe a little bit more adept at using, contrast ultrasound, looking for specific imaging characteristics and things of that nature that have been able to, again, separate out or at least kind of guide people a little bit more between, benign and malignant. And, specifically for this study too, I would say one of our limitations, which we unfortunately run into so often just in veterinary medicine in general, is just, a small sample size. And so I think even, further growing this study a bit more and making it possibly multi-institutional or having other clinics, large clinics, being able to evaluate kind of the same problem through the same lens would also be beneficial to kind of, further make this a bit more robust, even though we, of course, feel quite confident with what we found.
So if anyone's listening and wants to collaborate, you know who to reach out to.
That's right.
Always happy to collaborate.
Yes.
It's great. So, Hunter, are there any particular patient populations, tumor types, or stages of disease that deserve closer investigation next?
Yeah, I think one somewhat untapped area is we typically say dogs with primary liver tumors, so hepatocellular carcinoma, have an excellent prognosis. Once in a while, though, we have what I would call bad actors, where they do develop metastatic disease, which at this point, I really can't tell you what that which dog is going to develop metastatic disease until time. So like what Lisa mentioned too about biomarkers, like could there be a way to help distinguish these cases either in a preoperative or in the immediate postoperative period so we can help set expectations for owners?
And what's one thing, a tool or something else that would have helped you in this study?
I think one of the challenges we ran into is there's not a great definition for nodule versus mass in liver tumors in dogs. So even just some standardization of our terminology, I think, could be helpful for cleaning things up.
I didn't know that, Hunter. What are some of the different definitions? I would have thought it was based on size. I didn't
Yeah,
know there was lack of
we
homogeneity.
we reached out to our radiology team, and some people will say 2 centimeters, some will say 3 centimeters. Then when we went through the records, we would find sometimes like a 1.5 centimeter mass or a 3 centimeter nodule. So I think having more strict definitions might be really helpful in the future.
Why would it matter?
I think,
Does size matter?
yeah, I guess it'll like potentially, right? It does. I think, too, does would size potentially correlate with like nodular hyperplasia within the liver rather than being a true like neoplasia being, either hepatocellular carcinoma or adenoma. So I think teasing that apart more too would be helpful.
Yeah, and I think it does matter a little bit for, the more we can standardize things in research, I think the better because, I mean, just inherently by itself, mass sounds scarier to me than nodule, even as, just a surgeon. And, if you have one study like ours, it's like, oh, we define this as a nodule, and then another study uses that same measurement, but like this is a mass. I think that just again, you kind of end up with this bias as you're reading through it about one maybe being worse than the other when maybe we're actually comparing the same thing.
So, okay, how do you go about standardizing it? How do you go about ensuring that surgeons and radiologists and everybody else have a consensus on mass versus nodule?
Yeah, I think that's a great question. I think having potentially more cross-disciplinary discussion is helpful. I also think too, could there be working groups that help with this? With like VSSO, the Surgical Oncology Society, we've talked about it a little bit more for some of our histopathology, but I think there's a lot of opportunities for these working groups.
Yeah, it even could be something done retrospectively.
Yeah, very true.
And it teed up my own next question. Every time we do a study, we're like, oh, this is frustrating. If this were better, or it comes up with other questions. So what did this study open up for future questions for you two to answer?
It's interesting. So, of course, this focus was kind of like primary liver tumors and, specifically evaluating liver. Although, even, when researching this, I found another study that was talking about, splenic masses and splenic tumors, and then, finding nodules within the liver and how often do those correlate. And again, I think that potential misconception, well, as Hunter mentioned earlier, very fair to say have on your differential list. How often do we have other masses in, say, other areas that then result in, say, um, you know, pulmonary, say, metastatic disease, or just seeing pulmonary nodules? But, if we see one nodule or something of that nature, how often does that potentially correlate? And is that something that should then end up in a quote unquote, don't want to say death sentence, but really sort of starting to conclude the worst for that case just, preemptively? Whereas said nodule could be, something else entirely, or knowing that even just in some specific histopathologic diagnoses, even the presence of, metastatic disease or pulmonary metastatic disease specifically may not actually carry, extremely guarded prognosis, as dogs might still have a reasonable mean survival time, depending upon your definition of reasonable. But thyroid comes to mind, and those dogs sometimes even reaching like a year, even in the presence of pulmonary metastatic disease. So I think it'd be interesting to explore, that kind of realm a little bit more. Now, trying to get the histopath, say, on, a single pulmonary nodule and getting enough case volume for something like that might be more challenging, but it was a question that kind of came to my mind at least.
Yeah, building on that too, I think pairing what we did with like surgical findings and histopathology with some of these more novel imaging techniques, as well as with outcome data. So being more formulaic on that might allow for a more robust interpretation too.
Yeah, sounds great. We are very privileged to have this manuscript and several others on liver nodules, masses in dogs. It's clearly a very difficult circumstance and situation for the veterinarian and the team and the owner as well.
Yeah, I think it's one of, as a not so distant surgical trainee, one of the more intimidating areas, even for surgery residents, are surgical oncology fellow candidates. So, definitely a lot of opportunities.
Well, thank you both. We learned so much from your article and from talking with you today. Now we get to move on to the fun part of the podcast. And this is a little off script, but I have to ask you, Samuel, is that the Death Star behind you?
Yeah. It is the Death Star behind me. I am in my like true office, but I am a little bit of a Lego nerd,
It's
so there's
amazing.
a lot of builds. Yeah, and the Death Star happens to frame right behind my desk.
I love it. I've been looking at this whole time trying to figure out, I'm like, I think it's the Death Star. That's very
Yeah.
cool.
Yeah.
All right, and now we have a few more fun questions too, besides just what's in your background. So, Hunter, what's one belief or habit in veterinary medicine that you'd love to gently retire?
Yeah, I would have to go with, as a surgical oncologist, that histopathology is optional after a mass removal. My general opinion is if it's worth removing, it's worth submitting for histopathology.
That's a really good one.
Hunter could list little sayings, I'm sure, for like the next 30 minutes. He's known for having his catchphrases that are all very good for practice.
Big mass, big incision. So no.
Yeah.
One of ours in equine surgery was, "If it's not working, do something different."
Right.
Like,
Exactly.
Sam, for you, there's a lot of talk about work-life balance and all these things. What's one small thing at work or outside of it that reliably makes your day better?
I guess I would have to lean on that. Yeah, going back to my background. So, Lego, or building with Lego, I feel like it's been very beneficial to me. Kind of, did it throughout residency, did it in fellowship. I have more free time now, in my first kind of true position outside of all the training. So, uh, building with Lego, and also, I guess separately too, something I'm incorporating a lot more is, whether after work or before work, just going for a walk. I always used to walk to work, and I'm, trying to kind of get back into the habit of it here now that I have a little bit of a driving commute. But I feel like going for a walk kind of separates, a little bit of what I was doing with work, and then trying to, get back home, and gives you a little time to clear your head.
Yeah, that's fantastic. Did you like Legos when you were a child?
I sure did. I never stopped. So always been building.
Yeah, my stepbrother, And I use this as a icebreaker when I'm sitting at tables or conversations with people that I might not know very well, or if the conversation's taken a lull. As my brother-in-law always said, what made you happy as a child will still make you happy as an adult. And
True.
here it's Legos. For me, it's horses. Like just the smell of going into a barn full of horses and just touching my horse is just heaven. All the other things seem to fade away then.
Yeah.
Well, Samuel Hunter, thank you so much for joining us. We're so happy to have you here today to learn more about your article.
Of course, it was our pleasure.
Yeah. Thank you so much for having us.
And for our listeners and viewers, you can read Samuel Hunter's article in JAVMA. I'm Sarah Wright here with Lisa Fortier. Be sure to tune in next week for another episode of Veterinary Vertex. And don't forget to leave us a rating and review on Apple Podcasts or wherever you listen.